colleagues and friends, it's a pleasure and honor to be able to address the Planetary Health Summit and the 6th annual meeting. We're now convening to address some of the most pressing challenges of our time. We live in a turbulent phase of not only rising environmental and health challenges for humanity, to the point where we can today conclude unequivocally that we are putting the stability of life support systems on Earth at risk, which undermines our opportunities and puts at risk, particularly the most vulnerable, people's health in the future as we are moving towards closer and closer to points of exceeding limits of adaptation, but also approaching irreversible changes in life support systems and everything from the Greenland ice sheet to the Amazon rainforest, to soil productivity, to marine systems across the world. So we've now come to a point where safeguarding the health of our planet is fundamentally about the health of people, and we now have to integrate this at the planetary level. Science has come a long way to define the safe and just operating space for humanity on Earth. And let me here give you then a short update on the science showing the urgency of our challenges, the need for transformation, but also the good news that we today have so much evidence that healthy people and healthy planet is an integrated agenda for not only a sustainable future for humanity, but also for prosperity, equity, security, and health for all human generations or for all species on planet Earth. But let's start in the diagnostic. We can today, unfortunately, I would strongly argue, conclude scientifically that we've reached a state of planetary emergency. We're following a pathway that will take us to 2.7 degrees Celsius of global mean surface temperature rise just within 2 generations by the end of the century. But we've also transgressed 6 of the 9 planetary boundaries, which are the biophysical large environmental systems that regulates the functioning, the resilience, and the stability of the Earth system. So we have a double whammy. We're not only burning fossil fuels at a pace that is pushing ourselves outside of the corridor of life in terms of temperature over the past 5 million years. Can you imagine, within just 150 years, we're winding potentially back the climate clock to a temperature on Earth more than 5 million years back in time, which is way beyond any configuration of the planet that can support human life. So we are actually today facing risks of catastrophic destruction, huge population movements, widespread and extended conflict and migration, large-scale health impacts and death across the planet. This is very dramatic assessments, but I can tell you there's absolutely no evidence whatsoever that we can, with dignity, with responsibility, and with maintained levels of health, cater for 8, soon to be 9, 10 billion co-citizens on planet Earth, on a planet that reaches approaching 3 degrees Celsius of global warming, with undermining biosphere resilience in nature. So this is serious. And it's getting even more serious because what is happening so far, even before we've crossed any irreversible tipping points, is that the invoices are already being sent back from the 1.48 or 45 degrees Celsius of warming we've experienced so far, 3 times higher than the warmest temperature on Earth since we left the last ice age, by the way. It's costing us in the order of 300 to 500 billion US dollars already in terms of just droughts, floods, landslides, heat waves, storms, which have all scientifically been proven to be attributed, not in full, but amplified and strengthened by human-caused climate change. Moreover, what we're seeing right now is actually nothing less than shocking from a scientific perspective. I'm talking, of course, as you can imagine, of the ocean observations. You've probably all of you seen the graphs from the 1940s up until today. We have a significantly warming ocean. It warms roughly as fast as the atmosphere. So we have a 1.5 roughly warmer surface ocean. But then suddenly in 2023, something happens. Instead of just warming gradually year by year, which in itself is a concern because the ocean is absorbing 90% of the heat caused by fossil fuel burning, but suddenly the temperature just jumps off the charts. We have shocking increase of warming. It's actually more than 5 sigma events outside, so 5 standard deviations outside of the mean over the past 50 years. It's like a 1 in 100,000 year event. And not only did this happen during 2023, it is continuing now in 2024. And what we have to accept and honestly communicate is that we in science cannot explain what's happening. We cannot reproduce this in the models. It's not predicted in any of the climate models. We simply do not fully understand why is the ocean misbehaving in this biogeochemical way as we're experiencing right as we speak. We know we're in an El Nino phase. We know that the ocean releases heat to the atmosphere naturally during El Nino events. We've experienced several human amplified El Nino events, what I call super El Nino events, one in 2016, one in 1998. The third one is in 2023, 2024. But still, we see something going off the charts compared to what we would expect. Is this a first sign of us approaching a planetary scale tipping point? We do not know. But what we do know is we unfortunately need to seriously investigate that question, and that it is undoubtedly an early warning signal. So all of this takes us to the need to integrate planetary health and human health. My dear colleague and friend Joyita Gupta will certainly show very soon the latest assessments we've made on safe and just Earth system boundaries coming out of the Earth Commission. Let me just mention that that is a breakthrough research, that we can say scientifically that the safety on climate may be at the level of 1.5 degrees Celsius of global mean surface temperature rise. Basically, that is what the biophysical Earth system can cope with. Beyond that point, we're likely to cross tipping points of irreversible changes. For example, irreversibly melting the Greenland ice sheet, or irreversibly melting the West Antarctic ice sheet, or irreversibly causing an increased or faster rate of abrupt thawing of permafrost in Siberia. All of these factors self-amplifying warming. That's safety. Safety to keep the planet in a manageable state. But what the social sciences show, and what Joyita will certainly share with you more in detail, is that if we take people's justice seriously and look at the maximum acceptable levels of significant harm, we find, not surprisingly at all, that the just maximum limit for warming is actually around 1 degree Celsius. Go beyond that, and we see millions of people's livelihoods, health for millions of people being undermined, threatened by heat, disease, water scarcity, flooding, storms, all the extreme events amplified by climate change. So this just shows that if we take people health and integrate it with planetary health, we come to a point where the safe operating space shrinks even further, but it also emphasizes even more the need for an integrated approach, and that all we're talking about today in the agenda on sustainability, on the agenda of climate, has very little to do with protecting the environment. It has all to do with protecting humans and protecting our human health. So I would argue, and this is an interesting discussions that we've had in the Earth Commission, that I think the ultimate definition of justice is the right of every human being to be born on a livable planet. And that sounds perhaps quite basic when you say it, but we've come to a point where we cannot guarantee it. This is the point where we now have to start becoming stewards of the entire planet for humanity's future. It all requires transformations. The transformations mean we can no longer solve problems through incremental and linear change. Everything now boils down to scale and speed. Scale meaning we have to universally find pathways towards sustainable, healthy futures universally for all countries and citizens and societies across the world, but also speed. It cannot be linear, it has to be exponential. We have only 30 years to decarbonize the global economy and phase out fossil fuels. We have to halt biodiversity loss today. We have to make a U-turn with regards to circularity of material flows. We have to recognize that now is the time to really put sustainability at work. The good news is that we actually have scalable solutions. We know how to transition the global energy system. We know how to transition the global food system from its unhealthy current state that not only shortens the lifespan for over 10 million people annually because of non-communicable diseases, malnutrition, obesity, stunting, into a future where we can have a win-win outcome for healthy people and healthy planet. We also know how to have more circular resource pathways across the value chains in essentially every sector. So this is no longer fantasy. Being steward of the whole planet and transforming healthy, sustainable futures is actually something which is really explicit, it's really concrete, it can be scaled, and we know increasingly that it gives multiple benefits and synergies in terms of particularly stability, resilience, health, and security. So in closing, it is fantastic that you have this major gathering in Kuala Lumpur. It's also gratifying to know that your deliberations are aiming towards an outcome document. And of course, I really hope that you'll stay with the draft showing that planetary health really is about integrating human health with planetary sustainability, and that respecting scientifically defined planetary boundaries and governing these is fundamental for the stability, for the health, for the security, prosperity, and equity for all humans, all species, today and tomorrow on planet Earth. So good luck with your deliberations, and thank you.